Hi, everyone. I'm Steve Cohn, and I'm Chief of Marketing, Communications, and Philanthropy at Capital Caring Health, and I'm very happy to be speaking with you today. I think the biggest challenge is there's virtually no face-to-face contact with potential donors who run foundations or individuals heading companies or individuals themselves. But on the other hand, one can argue that because people don't have to have transportation time and either drive all over the place or fly all over the place, it's much more efficient to do everything virtually. And I think we're doing that as best we can at Capital Caring Health.
I'm Jason Parsons, and I'm the Vice President of Public Affairs and Philanthropy at Capital Caring Health, and it's a pleasure to be with you. It would echo Steve's comments. The greatest challenge we face is the inability to go talk to people face to face and share with them the extraordinary work that we're doing and how we're trying to meet the demands of the coronavirus pandemic. But also, I think it creates the opportunity for us to convey a real sense of urgency in our work as an organization very much on the front lines of the pandemic, which has enabled our supporters and our donors who want to be a part of our work to really feel that sense of urgency palpably, directly, and even in lieu of face-to-face contact, want to be a part of our efforts to try and serve the most vulnerable people in our community, people who are seriously ill, people who are struggling with the challenges brought on by the pandemic. So it's really created, in many ways, every challenge and opportunity for us to talk to people and bring them on board more rapidly, to really give them a sense that they're a part of something that's really addressing this urgent public health crisis.
Well, there are several strategies that we've pursued that have been very successful. One is having Zoom seminars featuring one has been featuring Dr. Eric DeYoung, who's our Chief of Geriatrics, and as most of you know, former president of AAHCM. And Eric's been talking about our primary care at home program to a number of different audiences. So it's great for passing that information along, and it's also generated financial support. Another one of our medical directors is Dr. David Steinhorn, who runs our children's hospice effort. And we're also doing Zoom seminars with him to, again, educate different audiences about all the amazing care we give for children with terminal illness. And of course, that also generates interest in supporting our efforts through voluntary donations. The one other thing I'm happy to report is that we've been doing galas for 30 years. This year, like everyone else doing a gala, it's virtual. We have a great theme, which is honoring the heroes among us, be they healthcare workers, delivery personnel, or social justice advocates. And we have seen a great response to this, and in fact, our net income from this gala will exceed anything we've ever done in physical gala form. So we're very pleased with that.
Well, we've really had a unique opportunity to think creatively about the intersection of people's funding interests and the work that we're doing. And we're very proud to be an organization that's on the forefront of innovation and being really a new age provider of advanced illness care, which is evidenced so much by the terrific work of Dr. DeYoung and his home-based primary care program. And looking at what opportunities we have to partner with people in new and novel ways. They give them a chance to exercise their hard-earned dollars to do good in ways that had maybe previously been unforeseen. So it's everything from our traditional opportunities to support care for patients who have no ability to pay, which has long been a bedrock of our philanthropy, but also really exciting and inspiring partnership opportunities. For one, with the Washington Holmes Duff Ice Cream Trust, we're able to provide ice cream as a sweet treat to oncology patients at a great partner of ours at Sibley Memorial Hospital, and also at our inpatient care unit in Washington, D.C. It's a really special thing for our patients and families, in a really unique way, and an outlet for the Duff Trust and the Washington Home to be able to give. Also, in a time when we certainly want to make sure nobody ever experiences the indignity of dying alone without the comfort and solace that can only be found in the presence of another human being, for a partner like the Eagle Force Warrior Foundation that said, we want to make a contribution to you to make sure family members, loved ones, next of kin can be at the bedside of a person at the end of their life, to be there for them, to say those last goodbyes or I'm sorry's and I love yous. And also, really excitingly, gave us use of a G3 aircraft to also fly in patients of our veterans. You know, in Washington, D.C., we have a tremendous veteran population, and we've been able to forge some really unique partnerships around meeting the needs of those populations.
I think having a very dedicated, forward-looking team, Jason being the primary example of that, along with Altanya Garrett, who really, the two of them have done an amazing job with getting foundations, corporations, and individuals to support us during this very strange and unprecedented time. And I might also say that something we highly recommend to others who may be listening, that having a professional grant writer on staff is extremely valuable. And we have such a person who works very closely with Jason, Altanya, and me. Two things. One, telling stories of incredible care are very important in terms of getting people to think about sending us bucks. And every organization like ours has incredible stories of care going on every single day. One I like to talk about is about a woman that we brought into our inpatient center called the Adler Center on the Van Meter campus, who her family wanted to move her from an assisted living facility because she had COVID-19. They couldn't visit her, and she's 102 years old. They put her into our center, the Adler Center, and not only did she get over COVID-19 with our care, we released her back to her family about a month ago. A woman 102 years old who was born during the 1918 pandemic. It's an incredible story, just one of many that we all have that potential contributors really love to hear about. So telling great stories, which we have a ton of, is a great focus. One other thing is we recently created at Capital Caring Health the Center for Equity, Inclusion, and Diversity. And we believe that that's a great vehicle for getting foundation and corporate support, as well as individual support. And we have, as part of a major mission through that center, to really get disadvantaged neighborhoods to understand about the services we provide, which they really, very few of them know about today. And we think there's a huge opportunity to help many, many people, many potential patients and their families get much better and needed care. And we think people will support that effort as well.